mynews.studio.
Picture this. In a small village in the Sahel, one vaccine is now stopping 5 different strains of meningitis. Could this shift how we handle epidemics around the world?
Today's date is November 25th, 2025. Let's start by setting the scene. When we say meningitis belt, we're talking about that long stretch from Senegal across to Ethiopia, right?
That's right. This region has faced some of the deadliest meningitis outbreaks in history. Now there's a new vaccine on the scene. It's called Men5CV, or Men5. It targets the 5 main strains of Neisseria meningitis that cause those outbreaks.
But this isn't just another vaccine, is it? What's actually new about Men5CV compared to the older ones?
It's a 5-in-1. So with a single dose, you get protection against all 5 of the major strains. That's a big leap forward. Before, vaccines might cover 1 or 2 strains, leaving gaps. And Men5 is designed to be affordable and can be stored easily. That's crucial in places with limited electricity or transport.
But reaching people in those areas, some are really remote, even hard to access during conflict. How do vaccination teams actually get doses to the people who need them?
They rely on mobile teams. Sometimes that means traveling by motorbike or even walking village to village. There are also big vaccination campaigns and collaborations with local organizations that know the area and the security issues inside out.
Is the rollout going smoothly everywhere, or are there still big obstacles?
There are major challenges, especially in places like the Sahel, where instability is common. Conflict can disrupt plans, and insecurity can put health workers at risk. But because the campaign is flexible, strategies can change quickly, and international support helps fill gaps.
You mentioned partnerships earlier. How big a role does community engagement play in making this work?
It's absolutely central. In Nigeria, for instance, respected figures like the Emir of Gumel have helped address doubts about vaccines. When leaders get involved, people listen. They trust the information and are more likely to show up for vaccination.
So it's not only about the biomedical side, communication is just as important. Are we seeing good uptake so far?
Early reports are promising. Where leaders help spread the message and communication is open, most people are getting vaccinated. Understanding the benefits and safety really helps participation.
Let's zoom out for a second. Does this matter only for the region, or could it set an example for the rest of the world?
It's significant globally. First, it gives immediate protection to millions. But also, it sets a template for how we might tackle other diseases like malaria or tuberculosis. The strategies here, using multivalent vaccines, mobile teams, and local partnerships, could work in many settings.
That's more relevant than ever with new or emerging diseases. Are there plans to use this same approach with other vaccines?
Yes, there's already talk about adapting these methods for malaria and TB. There's also focus on making more multivalent vaccines and building up local production, so countries don't have to rely so much on imports.
So, global health is shifting away from isolated breakthroughs and toward more integrated, collaborative approaches.
Exactly. The Men5CV rollout shows that progress comes from science, teamwork, and making sure everyone has access. When international groups, local health workers, and communities come together, the results are more lasting.
Do you think there are lessons here for countries outside Africa, even for wealthier places that still face problems getting vaccines to rural or underserved populations?
Absolutely. The same principles, outreach, engaging the community, making logistics simpler apply everywhere. This isn't just about one disease or one region. It's a new way of thinking about epidemic prevention.
So at its core, this story is about more than just a vaccine. It's about resilience and shared responsibility. If we can stop meningitis outbreaks here, what might be possible if we keep working together?
That's exactly it. Each successful rollout gives us more momentum for the next challenge.
Which brings us back to where we started. 1 shot, 5 strains, and possibly the start of a new phase in epidemic prevention.
Thanks for joining us today. We explored how the Men5CV vaccine is changing the fight against meningitis and what it could mean for health systems everywhere.
Thank you for listening. This episode was brought to you by mynews.studio. If you'd like, you can try it out for free.